Well, hello. Good morning, everyone, and welcome to this video presentation where we're going to be talking about a project that is based on One Health and an integrated management to health issues. In this talk, we're going to be talking about a project that has been carried out, well, is being carried out by, on one hand, a veterinary doctor and on the other hand, a medical doctor, studying a veterinary network from a social sciences point of view. Does that sound interesting? Well, then stick around. All right, so the name of the project is Evaluating CaribVet Network as a Community of Practice. What is CaribVet? First, I think it deserves an introduction. CaribVet is a very large veterinary network based on the Caribbean area with over 47 partners accounting for representatives of the governments of 34 of those Caribbean territories, representatives of at least five large international organizations, um, members of two research institutes, and also four universities. Who's carrying out this project? Well, on one hand, there is Sharifa Iliasu, medical doctor from Cameroon, and on the other hand, there's me, Pablo Gómez de Mayora Garcia, a veterinary doctor from Spain. All right, we are both currently involved at Liège University in the Integrated Management of Health Risks in the Global South master's degree, and our main partner is CaribVet. We've already introduced them. All right, so what were the goals? What are the goals of this study? On one hand, we wanted to assess the views of the members of the network from a subjective point of view. And on the other hand, we aimed at getting a better understanding of how information flowed both within and outside the network. These two things will help meet the recommendations of the steering committee of this network from the year 2020, which in turn will allow for improved network connectivities and the appearance of potential synergies. Both of these things are essential in order to have a better capacity at handling some of the issues that this network currently has to face. For example, the crisis following the eruption of the La Soufrière volcano in St. Vincent and the Grenadines, or the introduction of novel animal and zoonotic diseases. All right, so how has this been carried out and how is this being carried out? On one hand, we have semi-structured interviews lasting about 45 minutes where subjects touching upon the subjective point of view of the members of the network are studied. For example, what is the main value that the network is bringing to the area right now? What are the main challenges that you see working within the network, etc., etc., etc. On the other hand, uh, in order to assess the flow of information, which is more of the quantitative aspect, we have conducted a 19-question online survey that will allow us to conduct a social network analysis, which will produce a graph such as this one. And in order to make an SNA graph that is actually representative, we will actually need for nearly all the members of the network to answer this survey. So this is roughly our schedule. This is what we have been doing, the time that it has taken us to get a proper interview protocol, SNA protocol, how we have created video introductions for to inform the members of the network that we were going to need their help in this study, etc., etc., etc. So far, what we have obtained are semi-structured interviews from about 15 members of the network. We were expecting to get about 28, but we still have a few more weeks to get there. We have three persons that are going to be interviewed pretty soon. We have about nine people that have not answered yet, and we have two people that have expressed interest in participating in our study, but have not given us their availabilities yet. So what we expect from CaribVet in the following weeks is, on one hand, more volunteers, because we are only halfway through in that aspect. On the other hand, fast confirmation of availability because time was running out, and high response rate for the SNA because that quality of the data will really impact our recommendations. And then, what should CaribVet expect from this study? Well, on one hand, we are going to be giving them a report by the end of August with an in-depth analysis of the content of the interviews, the SNA graph, and then a set of recommendations based on the information above, and maybe a forecast of how following those recommendations would impact the network itself. So, thank you very much for your time. I hope this was at least a bit interesting. If you like this presentation, please head over to www.irtbarresearch.com for more very interesting presentations on the topic of One Health and integrated management of health issues. Have a good day.